so the moment one comes to know that one is the cancer is detected in a person, not only the person has multiple thoughts, scary thoughts, but also people around that person starts to advise, and ye to hona hi tha, because it was there in your family, it existed in your family, you had a history, and multiple things. So one fruitful suggestion coming from you कि क्या जरूरी है कि अगर फैमिली में है तो होना ही है, या किस तरह से लड़ना चाहिए इस बीमारी से?
पहली बात तो जेनेटिक एसोसिएशन सिर्फ 5% ब्रेस्ट कैंसर्स में है, 5% टोटल। अगर 100 लोगों को कैंसर होता है उसमें जेनेटिक एसोसिएशन सिर्फ 5% लोगों को होता है, 95% में कोई जेनेटिक नहीं है। तो फैमिली में था नहीं था वो इररिलेवेंट है। However, as the incidence is rising, you will gradually find almost every family or every third extended family will have something. So that is a given the way things are on the rise. But to say that family में था और होना ही है is almost absurd. हाँ, आपके घर में 2-3 लोग हैं या कोई इंसिडेंस है तो उसका जेनेटिक चेकअप करना, अवेयर होना is helpful, should be done. I'm not taking that away. But to label this is not good. And I want to answer your first question, that first part of this question, that तुरंत लोग एडवाइस देने लगते हैं कि ये हुआ। So मैं इसके लिए अपने पेशेंट्स को भी बोलता हूँ कि हमारे यहाँ जनरली जो जिसका मेन काम है ना, उसके अलावा वो हर चीज में लोगों को एडवाइस देता है। कैंसर वैसे तो सबसे आसान है एडवाइस करना, क्योंकि वो उन्होंने 2 लोगों को देखा है दूर से और उन्होंने उसके एक्सपीरियंस को किसी के ऊपर भी डाउनलोड कर दिया। ना ट्यूमर टाइप पता, ना स्टेज पता, ना कंडीशन पता, कुछ नहीं पता, बट एडवाइस दे सकते हैं कि भाई ये। सो माय थॉट इज दैट एवरीबडी शुड यूज नॉलेज टू एम्पावर एंड नॉट टू डिसएम्पावर योरसेल्फ। मेकिंग अ लिस्ट ऑफ क्वेश्चंस, going on the net, studying is good, it is helpful. Talking to people who have medical background in your family is good, and make a list of questions. Talk to one oncology team, talk to second oncology team, take a second opinion. All that is fantastic, but don't give too much emphasis on lay information जिसका कोई बेसिस नहीं है, कोई बात नहीं है। 2 मरीजों को ऐसा हुआ था, उसके बेसिस उसमें आप फंस गए तो फिर नेगेटिविटी आएगी और आप निकलना मुश्किल हो जाता है।
So that's all I Yes, a lot of awareness is being created through workshops and multiple things on breast cancer, but hardly anyone talks about the other forms of cancers like neck cancer or prostate cancer, be it anything. So how does one know kya symptoms ho sakte hain? How does one approach
to overcome all this, as you are doing this event for World Cancer Day? And so today, in today's world, from January to December, every month is designated to one type of cancer. Breast is for the month of March. In January, you have colorectal, and you have lung cancer a month, you have a cervical cancer month, you have ovarian cancer month. So all is spread throughout the year. And there are groups and there are efforts being focused for bringing awareness in every area. Somehow breast cancer picked up early because there was a tool to do a mammography and screening, and there was advantage of making aware and screening. And the general impression was that there's not much benefit because there's no screening tool to evaluate for other cancers. But today, high risk groups, lung cancer detection is recommended and screening is recommended. Oral cancer is awareness and by early biopsy is recommended. Colorectal cancer for certain groups is recommended. So today the world has shifted a lot. And for example, in our own hospital at Max, we have got support groups for different types of cancers. So earlier we used to have only one group for breast cancer. Today we have a stoma group for colorectal cancer. We have got a head neck group, Awaz, which meets for head and neck cancers. We have got a lung cancer group. So things have changed and are changing. But I agree with you that there's lopsided lot more focus on breast cancer compared to other cancers. And probable reason for that is that in breast cancer there was a screening opportunity, and so everybody wanted to focus on that so that to save more lives compared to other cancers.
Before I close the show, a message for the viewers on the World Cancer Day.
Okay.
And especially this time when there is still COVID fear prevailing, people are still resistant not to go to a hospital.
So before I give my message, I want to say a line on COVID and cancer, because this has COVID actually affected the cancer journey in a big way. A lot of people got interruptions in their treatment. They were on treatment, and during COVID they stopped going, and there were a lot of delay in diagnosis. People used to avoid going to their GPs, and therefore never got investigated. And when they landed in hospitals, there were more advanced cancers compared to times before. Having said that, I think in the long run, the outputs, the outcomes from COVID journey will be beneficial to all of us, because what I have seen, there's a huge digital upsurge that happened, and digital upsurge is one thing which will make a very big difference. Today, you are interviewing me from, I don't know where you are. I didn't even ask you where you are right now, and so it was not possible doing this meeting till about 5 minutes before I walked in for this. I was doing something else. If we had to set up this meeting and have an interview, half of my day would have gone, half of your day would have gone,
Certainly.
just to come to that point and all that. Today, we do our virtual tumor boards. We do connect with our professionals. Dr. Nitesh is in Lajpat Nagar. Somebody else is in Gurgaon, and we know, okay, 4 o'clock, breast tumor board. All the cases will come. Everybody will open on their phone or Zoom link, and then they will see, and then they're all connected. So finally, it will all come down to some rewards and some long-term strengths. But in the short term, COVID definitely adversely affected cancer outcomes. And this was one thing which was worrying for all oncologists globally. And so that is what I want to say. So as far as the message is concerned for World Cancer Day, I think nothing more important than being aware of your own body, and do not take any symptoms lightly. Anything you suspect, any symptom for more than 2 to 3 weeks, one should rule out cancer. Whether it's a sore throat, whether it's cough, whether it's one altered bowel habit, having a couple of loose motions, so it is beyond 2 or 3 weeks, then please go to a doctor and say, ki, please rule out malignancy. And don't stop till you have a diagnosis, whether it is non-malignant, but you should have a diagnosis.
Yes, doctor. Thank you so much. Thank you for joining us on the show today.
Thank you. Thank you, Shweta.
So this was Dr. HaritKChaturvedi with us today on Health Matters on the World Cancer Day. Meet you again in the next episode. Till then, take care. Bye-bye.
हमसे जुड़े रहने के लिए सब्सक्राइब करें यूट्यूब पर, फॉलो करें ट्विटर और इंस्टाग्राम पर, लाइक करें फेसबुक पर, और ज़्यादा जानकारी के लिए नेशनल खबर की वेबसाइट पर जाएं। आपको टाइप करना होगा सिर्फ नेशनल खबर।